Yeah, and I'm always fond of pointing out that actually no one could possibly be sure that the founder of osteopathy, Andrew Taylor Still, would not have used laser had he had the opportunity, but he didn't.
Understood.
There is a well-known tenet in osteopathy, probably similar in chiropractic, the rule of the artery is supreme. And you've talked an awful lot about blood perfusion and stimulating circulation and improving oxygen distribution, all that sort of stuff, all of which sounds as though it's in keeping with what we're trying to do to the body.
Yeah.
And I have a personal view that we're not here simply to adhere to the original principles of our founders. We're here to make patients better. So if there is a role in anything that comes across our radar, then perhaps we should be looking at it. You talked about your own problem with your lumbar discs. If someone came to your clinic complaining of a very similar problem, so there's a low back pain and they can't move, and you're thinking, well, this might be disky, it might not, and you've done your tests, and your clinical tests are inconclusive, would you use laser on them without further referral and say, well, we'll see whether this works, or would you only use laser if you've seen what's going on in the MRI?
We would make the recommendations based on what was right, and if a referral was right or necessary, then that would be recommended, irrespective of whether the laser was there or not.
But presumably there are plenty of occasions when your own clinical diagnosis has given you a provisional diagnosis, and you think, these are the tissues I want to treat, so I'm going to go straight ahead with laser.
Yeah, and we found that with certain things where there's a lot of pain, and some of this, I have to say, has been over the last 2 years, I won't say trial and error, but it's trying to figure things out in terms of where you want to fit things in and how you do it. And sometimes we'll use it as a standalone therapy. More often than not, we'll use it in conjunction with our standard package of care. And there isn't really a right or a wrong, that you can bring the laser into play at any stage, but sometimes it's actually beneficial to start off with the laser instead of the actual hands-on work, not always, but occasionally, to actually settle things down so you can then start to do the hands-on and the manual therapy work. And the two can very, very much interchange. So absolutely spot on.
How long has it taken you to get to a stage where you could make that clinical distinction? Laser first, hands-on first, both together?
I would have had the laser for a year, and this was just purely my decision, but we had the laser for a year. We did no marketing on the website, on any way, shape or form, just by...
You sound like an osteopath.
Just by making the clinical decisions at the time and then saying to people, we've got this technology, this is what we're familiar with, this is how we've used it, these are the results that we're aware of. Are you happy? Do we give it a go? Are you happy to trial it? And a lot of those trials done in the early stages, when Stephen brought the laser up initially, we had to have 10 cases, and we actually had 19 cases of all sorts of different things. And we made no charge for those cases at all, so we could actually get the experience with them to see how things changed. So I would say for me, it probably took me about a year or so before I was really happy where we could actually go out and market it. But it doesn't have to be that way. We could have done it a lot sooner. That was just our own choice, my own choice.